can be hard asking for help, especially when that help is offered by a team or a program that's new or claiming to do things differently, like Blue Circle Health. So what is it really like to be part of the program? Well, my name is Scott Johnson, and today we're having a conversation with Keshia Cannon-Peak, a former participant, about her journey with T1D, how she came to discover Blue Circle Health, and her experience as a participant. But before we continue, I do need to remind you quickly that we're not providing any medical advice, and for personalized guidance, we're always going to encourage you to talk with your personal healthcare team. I'm excited to welcome Keshia Cannon-Peak to the show. Keshia lives in the Delaware area and was diagnosed with type 1 diabetes in 1984. She went through the Blue Circle Health program about a year ago and frequently participates in our ongoing community events. Keshia, thanks so much for joining me today.
You're welcome, Scott. Thank you for having me. I appreciate it.
Yeah, of course. So I'd like to just get to know you a little bit better and help our listeners get to know you. You and I have both lived with type 1 diabetes for a long time, but tell me a little bit about your diagnosis. What was going on in your life? What do you remember from back then?
What I remember is being an 11-year-old little girl playing outside. It was in the summer times. It was really hot, and I was thirsty all day. To the point where I was just drinking like gallons of water. So I'm like, God, it's it can't be this hot, but it felt extremely hot. Continued to play outside. Later on, came home the normal, eat dinner, get ready for bed. And I remember waking up in the middle of the night and I was extremely thirsty. So I kept continuing to drink water to the point where water just doesn't seem like it was getting it. So I started drinking orange juice. I ended up drinking a whole gallon of orange juice in the middle of the night. And I'm like, my mother is going to kill me. They're going to wake up in the morning and there's not going to be any orange juice. When I woke up with my parents both telling me to get up because I guess they felt or heard me continuing to go to the bathroom. My mother woke me up and I can remember her like screaming. And I'm like, what happened? And she's like, go get yourself together, get dressed. I went in the bathroom and I could see my face. I was like gray. I was pale. Then I remember going to the hospital, and that was really it. I remember waking up, and when I woke up, there were doctors surrounding me. My parents were there. My grandparents were there. My aunts, my uncles were there. And I'm like, what is going on? I'm waking up like nothing even happened. So that's when they started explaining to me what was going on. So that's when it all began. So I had to get educated. At that point in the 80s, it wasn't a lot of knowledge.
Yeah.
I didn't know what an endocrinologist was. I didn't know what diabetes was. I just, it was just foreign information to me. I remember teenage years, it was tough. Blood sugars were always high. Then you had to check your blood sugar like every hour, it seemed like at that point. Going through puberty was tough because of the different spikes in blood sugar levels. Trying to get your friends to understand what it was without being afraid. I remember having, and she's my best friend today, a friend that would always walk with me to the nurse's station or the nurse's office when I had to check my blood sugar and take multiple injections during the day. But childhood was good. It was just the highs and the lows and just trying to fit in and just trying not to everyone to work, balance around what Keshia needs. Like, at home, we ate the same time, but when I wanted to go out with my friends, when you get older and as a teenager, it's like, well, I can't eat right now. And if I do have to eat, I don't want to pull out my syringe to take my insulin. So just not being embarrassed about it was tough.
Did you know anyone else with diabetes as you were growing up?
No one at all.
And what was that like? Did that feel at all strange, different? Did you feel isolated, or was it just kind of the way things were?
I felt isolated, but I had supportive friends, so they knew what was going on. They just didn't know the details around it. Everyone was supportive. It was just, again, if I wanted to go to the movies, I couldn't just eat the popcorn or drink the sodas. I had to be model. I had to drink a Diet Coke. The candy, I could, but I knew what would happen. So I'd be like, I'm fine. I'm good. I don't want it. But I did feel isolated. And I think it was just me. It wasn't my friends. It was me feeling like I was a burden sometimes because we couldn't do certain activities because they would think about what I couldn't do.
It sounds like you had a really supportive group of people around you, and I think
I
that's so
did.
important.
I did, yes.
Tell me a little bit about your healthcare team as you were growing up. What did that look like for you?
I had a great healthcare team. The only thing in Delaware is Delaware's small. We had 2 endocrinologists in the state of Delaware. There
Hmm.
was one who dealt with children, and there was another who dealt with adults. So I had a chance to build a rapport with my one doctor until I turned 18, and then they just would pass the torch to the other doctor. So I didn't have a lot of doctors, so the knowledge that I got were only from 2 doctors and some nurses that worked with them. Very great team. It's just I think because of the limitation, the education around it, the knowledge, I had to go and research myself,
Mm.
because they were always extremely busy.
What about as you grew into your adult years? I mean, are you still seeing that same endocrinologist or has that changed? What does it look like for you today?
Actually, he retired 3 years ago.
Okay.
So, I was working with a new endocrinologist. They were working together in the same office. So he like passed the torch on to her. So it's really been really good. Education wise, they have their own educators there. But again, Delaware's small and it's limited on the amount of
Yeah.
endocrinologists that we have here. I took advantage of everything that I could because I'm
Nice.
always curious and want to know more. So my healthcare is set up where I see the endocrinologist, and then 6 months from there, I'll see the nurse practitioner.
Mm.
Both of them are really good, so I'm never without seeing a doctor within a
Yeah.
year. In between their times, if I need help with adjustments to my insulin pump or CGM, the nurse educator is there. In between, they have a good portal to communicate. I'm blessed to have a really good team.
Yeah, it sounds like it. That's
Mhm.
fantastic. You
Yes.
mentioned earlier doing a lot of research on your own, like you'd hear about something and do some research. Tell me a little bit about that. Where would you find information? Are you looking around on the internet, communities of other people living with T1D that you would learn from? What did that look like?
Earlier, maybe over the last 10 years, 15 years, a lot of research on the internet, just the why behind diabetes, how it's changed,
Hmm.
mainly how technology has changed. It's changed a lot. And then the most important part, I think, would be just, again, with social media now, that's pretty much how I found a lot of all the different new insulin pumps that
Hmm.
are out here, the CGMs. I found Blue Circle Health on, just, browsing on social media and realizing it's a lot of people with type 1 diabetes that I was not aware of. The only time I would hear about it is if a celebrity or athlete would have it. But
Yeah.
other than that, anyone in my community, I don't know of any.
How did that feel to you, kind of recognizing that there was this whole world of other people living with T1D out there?
It felt really good. It felt like I'm not here alone. There are people like me. I just wish I could just have a conversation that they understood what I was referring to because I speak to people all the time about it. I try to educate as much as I can if someone asks or parents that have children with type 1 diabetes,
Yeah.
just being able just to be that voice. So whenever I was able to or have a platform, I would talk about it. I was never shy about it because I think education around it is needed.
Yeah, absolutely. Thank you
Mhm.
for being so open and sharing your story because I think too
Yes.
that all of us have a story to tell around our diabetes, and that story, my story may not resonate with someone, but your
Right.
story might. And so I think it's important
Right.
that many of us share our stories. As
Mhm.
you were growing up, or just kind of living your adult life, were there parts of T1D that maybe felt harder than others, or maybe even still feel hard?
I think one part is just always kept in the back of my mind when I was diagnosed, I was told that my life expectancy wasn't going to be that long. That's not true, but just navigating through that and just living life to the fullest. I think one of the most difficult times was when I was ready to have a child.
Mhm.
You've got to really keep those blood sugars under control. It's a whole nother, um,
Yeah.
yeah. And I had my daughter, so everything she's wonderful. She was fine, but it was a lot of work. It was a lot of work. Yeah.
How old is your daughter? How long ago did you navigate that pregnancy?
She'll be 21 in September.
Amazing. Wow. And I think that's remarkable too because
Mhm.
21 years ago we also didn't have as many tools to keep the blood sugars
No.
as managed as we did. So that's really, really amazing.
Yeah, it was tough. I had my insulin pump. I was still doing injections, all these things to keep your blood sugars. I was told at that time they had to be extremely low to help
Mm,
avoid complications. So she was a preemie, but I got her here healthy.
amazing.
Yeah.
Amazing. Oh, that's such a great story.
Mhm.
What are you using to manage your diabetes now? Are you on a pump, your CGM? Tell us some of the details around your setup.
I right now I use a tandem t:slim pump, and use a Dexcom G7 as my CGM. I love them together.
Yeah.
I switched to the tandem pump about 6 years ago. It was the best thing I could have done. Prior to that, I was using another pump in the past. And I've been using the insulin pump therapy since 1996. So
Wow.
yeah, it's been a long time.
Tell me a little bit about what was going on in your life when you found Blue Circle Health. You mentioned finding us or seeing us on social media.
So what was going on with me was I was searching for MDI. And for those who don't know what MDI, that's multiple daily injections. I was getting tired of being hooked up to a pump,
Yeah.
all this tubing, constantly being attached to it. Blood sugars were just getting real crazy. They were just up and down, even though I was doing what I thought I would do. So I was navigating who else is doing MDI. So when I put the search in, a couple of people who are on social media came up. And then there was this one young lady, I don't remember her name. And I think I did see a Blue Circle Health heart where they liked it. And I clicked on it, I'm like, Blue Circle Health. So I clicked on the button and I'm like, I'm reading about it. And I'm like, this is not real. So I go out on a website and I'm like, really? There's something that's geared around type 1 diabetes and some of the staff are, diabetics as well. And I'm like, I don't know. So I went on the main website and I'm like, it might be, I don't know. So I filled out the information and immediately I got a response back to my email. And I'm like, okay, maybe we're on to something. So then I got a phone call and I'm like, it's a live person. So immediately I got enrolled. It was a couple questions that were asked, and the enrollment specialist was amazing. And we're having conversations and coming, and I'm like, my insulin pump starts beeping. And I'm like, I'm so sorry. I'm like, it's loud. She was like, oh, what kind of pump do you have? And I'm like, oh, this is really rare. So we talked about that, and then I got signed up, and the rest was history.
That's amazing.
Yes.
Did you I'm smiling from ear to ear for those who
Uh-huh.
are just listening. Did you have any concerns or questions about how you would interact with, you're starting to engage with this Blue Circle Health team,
Mhm.
but you also have to navigate and maintain a relationship with your existing healthcare team.
Yes.
Tell me what was going through your head around that aspect of it.
I thought that at first, I'm like, how do I tell my endocrinologist I'm working with someone else? Um, do I need to tell them? And of course I do, because this is it's dealing with my diabetes. But once I started talking to more individuals at Blue Circle Health and getting the education around it, Blue Circle Health works directly with my doctors as well. Like they're sending notes behind the scenes and no one's stepping on toes. It's just that extra um, security and just another person to talk to. So after I realized it was good to go, I was okay with it.
And did you see your current healthcare team at any time while you were enrolled? And did the topic come up at all?
I did. The topic came up, and at that time, I guess I was maybe 4 months in, and my blood sugars were like amazing. So she's like, I don't know what you're doing, but it's working. And I'm like, I'm working with Blue Circle Health. And she was like, I did see some notes in your chart. I was going to ask you about it. Um, and she's like, my numbers, even since then, since I started, and even now, have been 6.2 or below.
Wow.
Not that they were extremely high before, they were in the 7s, and I always wanted to get them in that 6 range. But because I learned how to navigate, how to do things differently, and speaking to the educators that you all have, because I have type 1 diabetes, there are tools that they were giving me to really navigate through it and being educated at my visits, understanding what the charts mean, asking the questions why, recommending what I should change as far as a basal rate and things like that. So I learned that from Blue Circle Health.
Was there a moment where you thought like, boy, this is really different. This is something special.
Yes, I probably felt that way after my second visit with the educator and then the endocrinologist that I was working with. It was like there are people out here like me and they're making a difference. And I'm seeing, well, maybe, I don't know, like it was like an aha moment for me. Like I'm in from the corporate world and my education is around business. But when I was in when I enrolled in college, I had behavior science and psychology degrees. Nothing to do with business. I never knew why I was doing it. I just always wanted to, understand people's behaviors because dealing with diabetes, anxiety is there. It's always been there.
Yes.
People would never know that I'm dealing with anxiety, but because it comes so natural, or constantly looking at your insulin pump or constantly looking at your watch, you see that maybe this is not normal. If someone is like, am I boring you? I'm like, no, I'm just looking at my blood sugar. I'm sorry. I'm just looking at my blood sugar. That's all.
It's so funny because I have the same experience where
Mhm.
I'm talking to somebody and I'm curious about what my blood sugar's doing. I really want to look at my display
Right.
on my watch, but then
Mhm.
I'm worried that they'll think I'm,
Mhm.
yeah, that's so funny.
Yeah.
Moving from your typical clinical experience, where you're going in
Mhm.
and seeing someone every 6 months, and all of a sudden you've got Blue Circle Health, where you can have appointments almost as frequently as you need to, which can also be a lot.
Mhm.
Did you experience any challenges in that transition? Was it hard for you to make appointments, or what did that look like for you?
It was great for me to make appointments. Because again, I always wanted to know more about it. Every time I talked to someone there, I learned something new. I learned the little things as far as talking to an educator when my blood sugar was dropping. I was drinking apple juice, but I was drinking the big 8-ounce apple juice. I didn't know there was a 4-ounce. So
Hmm.
my educator there told me, "Hey, why don't you just go and try it? It's the 4-ounce. It's 15 grams." And I'm like, it was a game changer. Now in my car, there's apple juice boxes. They're not used, but it's just having that comfort zone, little things like that made a big difference. So I wanted to come more. I wanted to come every other week if I could, because I was learning, but I'm like, "She can't be selfish. There's other people that need the service too."
You have a busy life. Was it ever, overwhelming or disruptive to your life?
My appointments were after work in the evening. I remember having appointments as late as 7 o'clock my time. You
Wow.
don't get that anywhere, especially, in an office.
Well,
It's
let's take a quick break here. We've covered a lot
okay.
of ground and we've got more to talk about in a minute. Before we dive back in, I want to tell you about the D Box by Touched by Type 1. There's no sponsorship here. This is not a paid plug or an ad. In fact, they don't even know that I'm doing this. I just want to make sure that you hear about this great organization. The D-Box is a free starter kit full of resources and supportive tools for anyone in the country who's been diagnosed with T1D within the past year. And they have a D-Box for kids and for adults. It's available in both English and Spanish. Head over to touchedbytype1.org to learn more and request your free D-Box, or maybe share this information with someone you know who's been recently diagnosed. And the D-Box is just one of many amazing programs that they have as well. So be sure to check out everything else that they're working on. Welcome back. Well, Keshia, when you think about where you were before joining Blue Circle Health, what feels most different about how you live with T1D today?
I think what I've learned that it's okay to say you need help, that it's okay to say you're not having a good day, and it's okay to
Mhm.
be overwhelmed sometimes because I feel for me, living with type 1 diabetes is just, it's an assignment and a task in itself. outside of everyday things that you have to deal with. So I just give myself grace on days when I just don't feel like, here I go, I gotta change my infusion set, or I have to do change my CGM. It's okay to be not okay with that day. You get it done, but
Yeah.
it's just, yeah, it can be tough some days, but I find it easier to navigate because I know that I'm not doing this by myself. There's others out here, and I'm not alone. There's a big community of type 1 diabetics.
Yeah, I want to ask a little bit more. You mentioned something that kind of piqued my interest around it's okay to ask for help. And I imagine, at least in my experience, growing up with T1D, not knowing many other people with T1D around me, I felt very much like I had to do it all myself, right? It
Mhm,
was there. I didn't know who to ask. I also felt a certain kind of way about not almost admitting that I needed help with something.
mhm.
Did you experience that as you were growing up, and what helped you get over that um, hesitancy to ask for help?
I think for my mother was always supportive. She taught me not to let it stop me again, like my grandmother, to
Mm,
do things that I need to do, but it's okay. There's days when you're not going to be okay, when you don't feel well. It's okay not to feel well. It's okay not to push yourself because everyone sees you outside of home or in a work environment, totally different. They see a different person, but behind closed doors, you worry about if your blood sugar is going to be low. People don't understand when we go to sleep. The biggest fear is, my gosh, if it's going to drop, am I going to wake up?
right.
So those are the type of things that others don't think, that you don't think about because it's so natural for you.
Hmm.
But just knowing it's okay. It's okay to be okay, and just try to push yourself as much as you can and rely on family and friends, and
Yeah.
of course, Blue Circle and things just to help you support through those days when it's kinda tough.
Yeah,
Mhm,
I love to hear that your family was so supportive. I think
mhm,
that's such an important part of living well with T1D. And of course,
yeah,
not every family situation is like that.
mhm,
But it sure does seem to make things easier. I also had a very supportive family too, and so
great.
it kind of warms my heart when I hear about your mom and your grandmother just
Mhm,
helping you really deal with that so well.
yes, yes.
Were there any big turning points or aha moments? You mentioned the game-changing smaller apple juice. Any does anything else come to mind?
What comes to mind for me is, again, if I back me having education around behavior health, behavior sciences, once in the middle of being enrolled in Blue Circle Health and realizing that it's a need for people to talk about, that they need someone to talk to, not always fix their problems, but just to talk.
Yeah.
I've re-enrolled back in school and I'm working on my mental health clinical licensing. So I want to be able to help
Amazing.
others with diabetes and chronic diseases. It's needed. And I just want to be able to help.
That's so amazing, and I would say that is a pretty big, turning
Yes.
point, aha moment.
Mhm.
It's very, very exciting. Do you feel like your relationship with your diabetes itself changed? I mean, it sounds to me like you've had a really healthy, positive relationship with diabetes, but do you think it feels different now?
It does feel different. I think now that at the age that I am now, that realizing that I overcame the obstacles that they state I wouldn't happen. Now it's just time to embrace it, get more under, keep continue to educate myself around it, be open to all of this new technology. Because for a while I was just so set in my own ways. But it's so many opportunities and it's just so much out here. Even education around it is so different now. It's a part of me, but I'm also still always open to learn more about it.
I want to ask about something specific to the Blue Circle Health program. And for any listeners who are not maybe familiar with Blue Circle Health, we have a 6-month program. We hope throughout this that we're teaching and empowering you. We hope that you'll be able to use the tools and resources you gain during the
Mhm.
program long beyond, and that you'll continue to stay connected. Tell me a little bit about what that's been like for you.
It's been really good. I have flyers. I keep flyers on me. I pass them out. I've explained the program to my endocrinologist, um, even my dentist. About a couple months ago, I went to the dentist and was getting just a typical teeth cleaning, and the dentist came in to check my teeth, and my pump started making noises, and she goes to her side, and I'm going to my side. Come to find out, we both have the same insulin pump.
What?
And yeah, and I'm like, "You have to," she was like, "Stop."
Wow.
She stops in the middle of it. She's like, "This whole time I didn't," she's like, "I know your chart says type 1 diabetes, but I didn't get a chance to really, really talk about it." And I'm like, "Yeah." And so we're talking about our pump. So I'm like, "Well, I got these flyers in the car. I'll bring them back up after my appointment." And I'm like, "We need some education around dentistry as well." So
Mm,
I try to just pass out the flyers here in Delaware, tell as many people as I can about it. And yeah.
that's
Mhm.
amazing. Thank you so much for being such
You're
a great
welcome.
advocate for us. And
Yeah.
I love that story of, bumping into your dentist who also has T1D.
Yeah.
That's
Uh-huh.
what a small world.
Yes.
What about some of the ways that you approach living with diabetes now that are different?
I'm definitely more aware of I'm more set on now that I've got to the 6 range, right? Now that I'm at my 6 range is my A1C.
Which is amazing, by the way.
Thank
That's no
thank
small
you.
feat. Yeah.
Thank you. So now it's like, what else can I do? And, my endocrinologist and also the endocrinologist there is like, "We don't want it too low, Keisha.
Right.
Don't get too out of hand." So I'm like, "Okay, okay." So just understanding the numbers behind it, being open to other medications that can help with diabetes.
Mm,
Not just, there's different medications that can be used now, along the side, because with age comes different things, other
mhm.
things that can happen that you need to balance out with. Mhm.
Do you feel more confident in advocating for yourself now with like providers, insurance, and even people in your life? You come across as someone who's I would say never struggled with that as you're growing up, and thanks in part to the wonderful influence of your grandmother and mother. But do you
Mhm.
feel more confident today?
I do, but I've never not struggled. I've never not
Mm,
struggled. I may appear that I have never struggled, but I have struggled. And I think probably just being patient, and even when it's time to get a prescription and you need a prior authorization, just understanding you're gonna be on the phone. You're
yeah.
gonna be on the phone for a while. You just have to be patient, and not everybody understands the importance because we go into a defensive mode immediately. We need our
Yes.
medication, we need our medicine to live. And not that people don't care, but they don't understand what it feels like to be told, "We can't get this prescription filled, but this is a prescription that's keeping me alive."
Yeah.
And they're telling you, "You have to go through this channel, that channel." I don't have time for channels. I need my medicine.
Hmm.
So learning to navigate and having the patience and stepping back and saying, maybe I can educate this person and let them understand this is type 1 diabetes. I need my medication. And just doing it in a way where they can understand why why I need it.
Yeah.
And just learning how to advocate for myself and showing others how to advocate for themselves as well.
That's really great because there's a
Mhm.
skill there. You
Yes.
mentioned that we get defensive, but if
Mhm.
you approach that conversation in the wrong way, the person on the other end of the line, they
Yeah.
also can get defensive and then it can
Yes.
spiral into a very unproductive conversation. So
Right. Mhm.
you've always been a part of the community events that we have. You show up at webinars and group sessions and
Yeah.
things like that. Why does that feel important to you? To stay connected to the people in the community around your T1D?
I think because there's always something I can learn. And then this
Mm,
meeting new people and just getting contacts with people and just being around like-minded people that understand, that get it. Just being in that moment for that hour around some people that are like you is just amazing.
yeah. Well, it's always great to see you
Yes.
showing up at those events. So thank you for all the. I know it's not easy. We're all busy, and it takes
Yes.
time
Mhm.
to do that. For someone who's listening, who might feel isolated with T1D, what would you
Mhm.
want them to know about finding other people who understand.
Just be open. Don't be afraid to talk about type 1 diabetes. Don't be ashamed to show your insulin pump. Don't be ashamed to show your CGM. Social media is not for everyone, but there are some platforms that are good that you can go on and get some information and just start building that rapport with others who maybe, that has type 1 diabetes, and just to be open to questions, and even raise your hand. Talk
Yeah.
to your endocrinologist, your doctors. They definitely can help as well.
Yeah, I love that. How do you carry forward some of the lessons that you've learned about managing T1D without feeling that pressure to be perfect?
I just live in a moment. If I think anything differently, it can become overwhelming. Um,
Mhm.
that took a long time for me to get to that point in life. Because some things are just out of your control. If I do
Yeah,
everything I can possibly do and my blood sugar still wanna act crazy, as I say, I can't do anything else but to be patient and, to stay on top of it. Just stay in the moment. I try not to think too far in advance because it could be low now, it could be high tomorrow. It could be high
yeah,
today, it could be low tomorrow, and it will drive you insane if you keep looking too far in advance.
yeah. I think that's a very wise approach.
Yes.
What would you say to someone who's thinking about reaching out to Blue Circle Health or maybe just starting to work with us? Do you have any thoughts or advice?
It's real. It's not fake. Everyone is supportive. It's just amazing to know so many people that are in the profession, doctors, nurses, educators that live with type 1 diabetes as well. It's just a great feeling to know that you can talk to them and they understand how you feel because they live it. Not only can they educate you, but they can also give you tips that work for them. Every tip doesn't work for everyone, but at least you could just try it.
Yeah, I think trying, living
Yeah.
with diabetes, it's very much an experiment. You have
Yes.
to try something and see if it works and make adjustments. Yeah,
Yeah.
very well said.
Mhm.
Well, Keisha, we've covered a lot today. And as we wrap up here, if someone just takes one or two things from our conversation, what do you hope that is?
That you're not alone. There is a type 1, a type 1 diabetic community out here. Not to get frustrated. Stay educated and just live well and do the best you can do.
Well, Keisha, thank you so much for talking with me today. I really appreciate it.
Oh, thank you for having me. I appreciate you.
This episode's another great reminder that you don't have to do diabetes alone. Even if you've been managing diabetes for a long time, support, connection, and community really do matter and are out there for you. If nothing else, I hope you'll give yourself permission to ask for help if you need it. And as Keisha mentioned, give yourself grace on those days when you need that as well. And then be sure to tune in for our next episode. Until then, keep living well with T1D.